Welcome to SAM Conversations. I am Tarun Basu. Public health is very much in the global spotlight as COVID-19 brought in its wake disease, death, and disruption, pushing health services all over the world, I think in more than 220 countries, to the brink. Governments, policymakers, international institutions, experts, NGOs, even the public are grappling with the issue of public health, talking about it, debating it, as governments realize the inadequacy of policymaking, shortage of funding, and simply inadequate attention to the issue all these years. To discuss all this, we have with us today Dr. Nikita Bathla. Dr. Bathla is a medical doctor who is now doing her dual degree in international public health and health management at UNSW Sydney, the University of New South Wales. Her areas of interest are prevention and management of non-communicable diseases and health system research. There cannot be a better person than Dr. Bathla to speak about this issue today. Welcome, Dr. Bathla, to Conversations.
Thank you, Mr. Basu, for having me.
Dr. Bathla, with public health so much in the global spotlight, and India and developing countries grappling with the issue and trying to meet the emerging challenges, how do you see India faring in the last 2 months or so on this?
Mr. Basu, in my opinion, every country comes with its own issues. India, the COVID-19 pandemic has exposed deficiencies in health systems all around the world. We've always grown up, seeing that higher income countries, we always believed that they would have better health systems and they would be better equipped. But it seems like the world at large has been gravely underprepared for a pandemic like COVID-19. India, in a lot of people's opinions, has fared better than most in terms of early response. But it seems like we're still reacting. We were not prepared. Our health systems were not prepared. And that's why we've come to a situation where we need, lockdowns, we need restrictions in place for our public so that the health systems themselves can prepare themselves in the case that they become overwhelmed, which is very likely with a pandemic of infectious disease like COVID-19 is.
What you think is the single biggest deficiency in our public health system that this pandemic has brought out?
I don't think we could call it a single deficiency because a health system itself is made of various very important components and it cannot function without any of them. This goes from health system financing to workforce deficiencies. There's been essential medicine crunches, accessibility of health services across the country with a size and population like India's and a imbalance between the public and private health systems. We've seen a lot of disconnect in our health system. And for example, we only, as a country, the government spends 1.2% of its GDP on health. People in health have been pushing for 2.5% for decades now, but it seems like it's obvious that our priorities were in economic development. I think one very important point that the pandemic has brought forward is that health is essential for the economy of a country. The economy has been in a lockdown just as long as everyone else has. And so it's very important to put our focuses, our funding, our workforce resources into health to be able to not only deal with this now, but also in the future.
That is very well put. Listening that day to Dr. Devi Shetty, the renowned cardiologist, he said, the country doesn't seem to even have a database of our doctors and other specialists. We
That's
don't
right.
even know how many doctors are there, how many nurses are there, how many epidemiologists are there, how many anesthesiologists are there. So you say, on one hand, while we are buying ventilators, we don't have enough anesthesiologists to handle them.
That's true.
So
That's very accurate. The WHO itself estimates that a country needs 44.5 doctors, nurses, and midwives for 10,000 people of its population. India is grossly below that. It's below even half the mark. And we don't have consistent databases for our health workers, nor do we have databases of our health facilities. So we don't know how many hospitals there are in this country. We don't know how many nursing homes. We don't know how many, Ayush practitioners are there, for example. We've brought them in, we've brought the traditional practitioners into the mainstream, but we don't know how many of them are there. And I think this stems from the imbalance between the public and private health sector. Because the public health sector was inadequate in managing our health needs since independence, the private health sector has become where people go to for health. And
middle
because of,
classes. Yeah.
and yes, that's right. And because of, it's not only the middle class, in fact, even rural populations, socioeconomic classes, the lower socioeconomic classes, they too go to private practitioners because there's no faith in the public health system. And that comes from a lack of funding, that comes from deficiencies in the workforce. You might enter into a health center and not find a doctor there, and that's not acceptable to you. So you say, okay, I'm going to pay out of pocket and go to a clinic, for example, being run by a private practitioner, and get my health sorted out from there. So it's just all of this that's coming into the spotlight now because of the pandemic. And I think that we could all use this as an opportunity to recognize how important health is in today's day and age, and how important it is to invest in our people, in health facilities, and in data. We need to be able to have baseline data to be able to deal with these things. We need to say that we have these many hospitals for these many people, and this is what our system is capable of. We don't even know what our system is capable of.
What you are saying, essentially, it's a huge wake-up call for countries
Right.
like India, which
That's
spent less than 1.2% of its
That's right.
GDP on health.
Mhm.
Now, I was hearing the health minister that day, which he's talked about that from now on, you will see much more increased public expenditure, government expenditure on health. He talked
Right.
about some 2.5% figure. And yesterday I read about the northeastern states who are, in infrastructurally, in terms of health infrastructure, quite backward. They
That's
were
right.
talking about that health should be given priority.
Another
So
very
that is a welcome
That's right.
change in thinking, in policy thinking.
That's right. But another thing that I would like to, bring to the forefront is that just because of the sheer size of our country, policy is health. Health is a state subject in India. So if health is a state subject, it automatically becomes decentralized. So it might be that the central government, makes certain promises, but at the end of the day, it's up to the states to implement health and healthcare delivery, at the state level. And we all know that all our states fare differently across different indicators, whether it's health indicators, social indicators, economic indicators. So at the end of the day, it's up to the states to implement healthcare service delivery that's acceptable to the Indian people at large.
Dr. Bathla, this brings me to the issue of education and training of public health professionals, doctors, nurses, and other experts. Now, hearing Dr. Devi Shetty, he was talking about the enormous costs of setting up a medical college.
Yes.
And he says because of the enormous costs involved, it is not cost effective to have so many medical colleges, and
Right.
especially those which are linked to hospitals.
Yes.
So there is one thing linked to another, and basically says these are economically not very feasible.
Yes.
So where do you see, as somebody who has studied in India and then gone to Australia, studied in one of the best universities there, how do you see India bridging the gap? Do you think one of the ways is to link up with global public health institutions and universities like the school in your UNSW School of Community Medicine and Public Health, or the George Institute where I think you are presently working?
Yes. So I think it's very key to recognize at the medical education level. I've been through the system in India. And while I was doing my MBBS, something that I didn't realize I was missing out on, that I realized only later when I went to do my master's in public health to Australia at UNSW, is how important it is as a doctor who practices medicine to have skills like critical thinking, like communication, like reflective thinking, like the importance of research. And that's something that I don't think the medical education system, at least that I was part of, has really put any stress on. Medical students are always focused on exams, on what's been asked the years before. It's all very structured, and something that we haven't experienced is to be innovative in our thinking, to ask questions, to look for evidence in our practice. And that's something that I
To
think is
question more.
right. So that
Yeah.
is something that's called critical thinking.
Yeah.
And I never heard that word until I went to do my master's at UNSW. And I think that was it was a wake up call for me to see, why do I always listen to what someone says and take it at face value? Why haven't I asked before, why is he saying this? What does he know that I don't, that makes this person say this to me? And in correspondence with my colleagues at UNSW, I've learned that in Australia they have 6 years of medicine as opposed to 5.5 years in India, and 1 year is purely research focused. So when you have that focus in research, you automatically start to critically think, to appraise literature. I'm reading this, but where did they get this data from? What does it mean that they got this data? Is this data accurate? What are the holes that I'm seeing in what I'm reading? How can I make this better? This is a gap that I've identified. This is what I want to work on. This is not part of our Indian medical education system. We've been put through roller coasters of entrance exams, but our critical brain has been dormant. And that's something that I think is very important to inculcate into our doctors, into our nurses, into our health practitioners at large. There's no reason why epidemiologists or public health professionals should be the only people who know how to read and write publishable papers. There's no reason why that should happen. In India, we often say our patient population is so huge, we don't have the time for research. But if you do a research focused year in medical school, you don't need the time for research. You automatically start thinking like that, and that's the key to being able to treat patients in a different, novel way.
So if tomorrow the health ministry or the government reaches out to younger people like you, younger health professionals like younger doctors, says it, so what do you suggest? Where did we go wrong and where do you think we should be going? What are, in terms of 1, 2, 3 things, priorities that Indian medical education, the infrastructure, the way, the pedagogy, everything, where do you think the changes should be prioritized?
I think critical thinking is an extremely important facet, which you will never realize until and unless you actually delve into it. Research is another one, which I don't see why we can't do as part of our medical education. The 4.5 years that we do is quite jam-packed, yes, but I think it adds a lot of value to future practice if we are trained to do this as part of our medical education. Facility wise, I think it's a bit more difficult just in terms of the disparities that exist even in cities and rural areas. And I do understand that there are a lot of economic factors at play in setting up medical colleges, in making sure that people are trained by people that are able to train them. A lot of our professors aren't trained in education. They're just doctors, and they're good doctors, but they're not educators, they're not teachers. And so maybe our colleges should be looking at who's teaching them and are they really equipped to teach? Because, in Australia, for example, you have to have a PhD to teach. You have to, be research focused. Their key performance indicators are different. They need to publish papers, they need to do presentations. So all of these other skills that we're picking up, for example, communication skills, critical thinking skills, these don't come from textbooks, and these don't come from teachers who only know what's in the textbooks. And I think that's something that we could really use as the young Indian, medical workforce that's going to be carrying our country forward in looking at a post-pandemic world, as they say today.
Among the many areas that stand severely disrupted is education.
Right.
Education is not going to be the same again, at least for some time.
Mm-hmm.
We have to forget, parents and students have to forget campus learning. They may not be able to do the face-to-face teaching which one has been used to.
That's right.
Universities across the world are gearing itself to do online teaching. The things that you are talking about, the prescriptive changes that you're talking about in the medical education and training of health professionals, etc. Do you think the same thing can be done with online teaching? And especially a university like UNSW, do you think it is more geared to do that than maybe any other universities?
Absolutely. UNSW has been more geared to do that. My program itself, the MIPH, MHM, the Masters of International Public Health and Health Management, has been running its courses face-to-face as well as online side-by-side for years now. And that's because they know that they need to deliver their courses to people who practice medicine, who are currently health managers, or who are in the field, implementing their programs. And so we do have people that do the course purely online. It's international students who go for the campus experience and go to the face-to-face classes. For example, if in a class we have 300 students, maybe 100 are going there face-to-face, but the 200 are doing it online as well as working part-time. So I think UNSW has, at least the School of Public Health and Community Medicine at UNSW, has been equipped to provide this education to people as and when they work and alongside their working. So I don't see why this would be a difficult approach for them. But as far as university education goes in India, obviously we have accessibility issues. We have, if you live in a city and have good internet connection, online courses are possible. But we also have to look at from the equity perspective, is it possible for everyone to do it? And I don't know about that.
I was a little curious about this dual degree issue. That's not a very popular thing in India, but in universities like UNSW and several other universities, global universities, do offer it. What made you go for this dual degree, and how has it come to your help?
The dual degree, in fact, is the reason that I went to UNSW. After finishing my medical degree, I was convinced that I didn't want to practice clinical medicine. I wanted to make an impact on the population level. And so when I started to do my research on what I could do my master's in, I saw that I had a couple of options. There was a master's in social work, there was a master's in public health, there was a master's in health administration, there was an MBA. So all of these were options for me as a medical doctor to go forward and do things at a systems level or a management degree, that kind of thing. And initially, having worked in a hospital and seeing, that there's so much scope for improvement just within our hospitals, I decided I would do masters in health administration. So that was my path. I applied to a couple of degrees in India for masters in health administration. And when I was considering going abroad, I saw that UNSW had a dual master's degree for the same duration of time. So that was a master's in public health and a master's in health administration, or health management as it's called there, and for the same duration of time. And for a young doctor like me who wasn't really sure which path was best suited for me, I thought maybe take the public health along with it. You get 2 degrees for the time of one, and you never know where it'll take you. And in fact, for me, I went into it thinking I would become a health manager. And today I want to be a public health researcher. So it was the public health that kind of took over my ambition, and that's what I want to do now. So just offering this dual degree broadens the scope of what people can do with this degree. And as I said, health is so intertwined. It consists of so many different parts. So I ended up doing, for example, a health economics course as part of the health
Wow,
management degree,
that's
but
so
an
interesting.
outbreak investigation course as part of the public health degree. And you realize that these are all intertwined. Of course, economics comes into play with health. And of course, a public health practitioner needs to know the basics of economics and accounting to be able to effectively implement a program. So
Uh,
at the end, it all makes sense. And I think offering a dual degree at UNSW and even taking it up for me has been the best decision so far.
Optimistic or maybe pessimistic are you about countries or even the humanity's ability to come out of this unprecedented crisis,
Oh,
possibly the worst in 100 years?
I'm absolutely optimistic. I think human beings are extremely resilient, and there's very little that we cannot do. It's just that we need to be responsible in doing it. And I think people who are lucky enough to have educations as I have recognize that there's very little that we can't do. So I'm optimistic, and I think we will find a way at the end of it all.
That's wonderful to hear, Dr. Butler. That's wonderful takeaway from you. I myself have learned a lot. I have become more optimistic about after
Oh,
hearing what you have said. I have, and I think I would like more and more young people, especially medical professionals and people who are wanting to get into the health sector, to probably hear this conversation of ours, which we will widely share. And
sure.
to be nice to talk to you again in a couple of months after I
Absolutely.
think things are get more better, hopefully. And I
Sure.
will also invite you to write for South Asia Monitor in the future.
Sure. I would
It's
love to.
wonderful talking to you, and all
Lovely
the
to
best for you in your career and what you have set out to do. Thank you so much.